Can dentists predict the future? How long can you delay getting dental work? How long can I wait to get this cavity fixed? Is it okay if I wait 6 months? I think my last dentist told me there was a cavity there and he wanted to watch it. Is it getting bigger? Common questions in the dental office. Great questions. Let's dive in. First, I'm Larry Dougherty. I've been a dentist for 16 years, and you can find me here at Rolling Oaks Dental in Garden Ridge, Texas. With access to old x-rays, models, and scans, I sometimes have the benefit of seeing the past. With my eyes, my loops, my light, my infrared scanner, my digital x-rays, my AI detection software, I'm pretty good at seeing the present too. The future? I'm not very good at seeing the future. What does that have to do with conservative dental treatment? Let me explain. Every time I observe tooth decay during a dental examination, I inform the patient of what I see. If they're interested, we discuss treatment options. There are many patients that hear the word cavity or decay and freak out. They want it fixed as soon as possible. However, many patients ask questions. How bad is it? Can it wait? Does it need to be treated? Truthfully, I don't always know. I think the longer you do anything, and I've been doing dentistry for 16 years, the more you truly appreciate what you know and what you don't know. Also, the more you realize what an honor it is for someone to trust you with their healthcare choices, the more truthful you want to be with them. In the pursuit of truth, let's continue. I've never heard a dentist talk about decay the way I'm about to talk about it, but I think this will make sense to dentists and non-dentists alike. I'd like to classify tooth decay into 3 categories: fast-moving, not moving, and slow moving. Fast moving. I've seen teeth that had small cavities that could have been fixed with small fillings turn into teeth that can't even be fixed at all within 6 months. This is rare, but ask any dentist that's been practicing for a while. We've all seen this. Some cavities just grow fast. Not moving. I've also seen teeth with untreated decay go for years with no evidence of increase in size or severity of symptoms. The decay is obviously there, but the process of growth for decay is arrested. This is common enough that I see cases of it almost every day. Cavities just sitting there, chilling. Slow moving. Of course, there's the classic cavity that appears very small clinically or on an x-ray at first, gets bigger a year later, keeps getting bigger, eventually makes its way to the nerve, and now it hurts the patient. Along the way, treatment options went from fluoride and oral hygiene improvement to a small filling, to a big filling, to a crown, and made it all the way to a root canal and crown or potentially extraction of the tooth. From first sign of cavity to untreatable cavity, it might take 3 to 6 years. That's probably the most classic presentation of an untreated cavity.
Okay, cool. Dr. D, you've told me I have a cavity and you've told me about the 3 different speeds. Just tell me what speed I have so we can make some plans here. I really hope you say it was a not moving because I don't want to do anything. Do you happen to have some kind of radar detector for cavities?
Remember when I told you earlier there's things I don't know? That's what I don't know. Fast moving, not moving, slow moving. In real time, I just don't know.
But can't you just guess based on your experience, Doc? I've been going to the dentist every 6 months for the last 10 years. I think the last dentist told me he was watching that cavity. Can't we just wait till it hurts? Isn't that okay?
I'm going to add one more wrinkle to the fast moving, not moving, slow moving explanation. Things can change really fast. Our diets are constantly changing. Our overall health and habits are constantly changing. Even if we don't think those things are changing, our bodies are aging and their response to the same inputs is changing. Dental decay can speed up, slow down, or come to a standstill at different phases of our lives without a lot of warning. So, what should we do? What should you do? Leaving any tooth decay in a patient's mouth untreated is a risk. Many patients are risk averse and want to treat things when they are small and easy to treat. Some patients want to take a risk and see what happens. I can't predict the future, and I can't tell people how to be with respect to their risk aversion. I can only inform patients, offer solutions, and do my best to treat them conservatively and compassionately. Predicting the future? I'm not great at it. Estimating the speed of the decay process in a patient? I simply can't do it. At least not yet. Predicting the future. Every day, patients think I can do it, but what if I could predict the future? I always tell them the first thing I'm gonna do is close the office. If I can predict the future, I won't waste this power on figuring out if people should do fillings or not. I'm gonna do what every American guy born in the 80s would do. I'm gonna gamble on sports and become rich, just like Biff did in Back to the Future 2. I'm gonna live in a crazy penthouse mansion and live happily ever after as the world burns down around me. You know what, Marty? That's just too much. Here's what I'll do. Just for you, I'll keep the office open and just use the power to tell patients, yeah, this cavity's gonna double in size in the next 6 months. You better get that filling. You might have to do a crown. Patients will ask me how I know, and I'll tell them I can see the future. And then we'll chit chat about it for a few minutes. I kinda like this better. Until that day, I think I'll just keep practicing dentistry the regular way. So see you at the office.